I'm Mario Goisis and I work with beauty. I work with beauty because I'm an aesthetic surgeon and because I do many courses and I do treatment in many different phases around the world. So let's travel together. We are in Milano and we are in one of the best corners of Milano. Close to him is Constantine. He was a famous emperor and the topic of this episode will be the beauty of males. So today we will do treatment on males in different parts of the world, of Europe, but we will go even outside Europe. And we will go even in the original place, in the country of Constantine. Constantine comes from Illyria. Illyria is now Albania. And in Albania we will try to understand the difference between the beauty of men and the beauty of women, starting from a classical manufacture of the time of Constantine, even before the time of Constantine. Despite of that, we will do other patients, all male. Here in my clinic is just behind here, in the heart of Milano. And we will move to a quite close, a luckily close country in which there is a big war and we will treat soldiers. Even Constantine was a great soldier, That's why he became emperor of the Roman Empire. And after that, we will move to the extreme part of Africa, to the Cape, to do treatment on the more masculine things that we can imagine. So it will be a very interesting episode. Let's go together. So Sima, what's our next destination?
We are in Albania.
Albania, that's great. And she's our patient.
She's our patient. This lady sent to me
the photo and she's perfect for our topic. We do her during the Congress, right?
Yes, of course. She's like a model.
Super, super. Okay, even the 3D is good. Please leave me 2 hours because I want to go to the museum.
Museum?
Yeah, I want to go to the museum because I'm thinking about a perfect combination. She looks like a very famous lady of Albania, which is in the museum.
Okay, if you want.
And we have even another patient.
Yeah. He had a trauma.
Oh, he has a big horse here at the center of the frontal area.
Particular story.
Okay, particular story. You say me it's a quite strange story, but all the story of our patients are strange.
Yeah, of course.
And did he send you the X-ray?
Yes, of course.
Okay, so X-ray are okay, no fracture of the bone. Okay, all is intact, so it will be quite easy to do. Super, let's go. Today we are in Tirana. Tirana is the capital of Albania, this small nation at the center of Balkanic area. It was a strong communist country. We can see in this central square all the socialist style building. the opera theater, the cultural center. Albania was a very strict regime compared with Soviet Union. They were more communist than Soviet Union, and after that we were linked to China. But after the death of Mao, we were more communist than China. So finally, till 1990, we were totally isolated. And in one of these buildings, in one of these socialist communist building, there is a special art piece, and this special art piece is the topic of our day. We are going to see her. Let's meet her.
We are in front of one of the most important masterpieces of this museum, the most interesting for us. Why? Because first of all it's wonderful, it's a marble of the classical era of Greeks, it's on the 4th century before Christ. This area was a very rich area. It was the area of the Illyrian population, it was the area of Epirus, but in that period, in the period of the classical Greece, it was the area of the classical art. And from this marble, which was discovered by an Italian archaeologist in the 20th and 19th century, there is a wonderful representation of a beautiful woman. So these archaeologists called her the goddess, the Venus of Bitrintus. Bitrintus is this city in Albania. And let's look at her. She's really beautiful, but if we look at her in the profile, we see that the profile is a masculine profile. So from the front, she's a beautiful woman. From the lateral side, look, this strong angle of the mandible, this very narrow nasolabial angle, these are characteristic of a man. So from front, she's a beautiful woman because of big eye, because of narrow nose, because of the lips, because of the narrow triangular chin. But from lateral is a man.
But how Albanian's woman looks like? If we look around on this beautiful population, because Albanian women are for sure beautiful, we see that the faces are quite strong. The nose is quite important, for sure it's not small. We have a mandibular angle which is quite open, so the typical Albanian women are a little bit masculine. So that's why today we will try to work on this aspect in order to improve the feminine aspect of our models. Let's meet the organizer of this wonderful congress, ASCAD Congress, the fourth congress here in Albania. Hi Brunilda.
Grazie.
How are you? Bene,
Great.
bene. Brunilda speaks in Italian because Albania is the only country in the world in which all the population speak Italian. And the idea of this congress is to train doctors, so to share our experience. Please, Brunilda. To share our experience and to do practical demonstrations. So the idea is not to show how good we are in injection, but to involve our colleague in order to offer a good training in order to understand how to inject in a good way, because the final aim is to have beautiful patients,
Yes,
and in a
beautiful and normal.
and safe.
Yes.
And safe. So to avoid, to prevent complications. How many doctors are at this congress, Brunilda?
Yes, in this congress are more than 150 doctors.
Super. And what kind of specialization do they have?
Mainly they are dermatologists, are plastic surgeon, and one part is doctors who are applying cosmetic dermatology.
Top stand. In all of the stand are exposed medical product to inject. So doctor can have experience of the product, can order the product, can buy the product, and inside we have rooms, right, Brunilda? In the rooms we have workshop, so we can speak. Here we have our colleague Dr. Costas, Chrysalix ready to inject.
The program is to make a more feminine shape of the face. Okay, ready to do the treatment.
We are inside the Congress room, and as we can see from this image, our model doesn't look like our model of feminine face, the Venus of Butrintus, or better, the Apollo of Butrintus. Why? Because she has a very squared face. Our Venus has a triangular face, so we have to elongate the face of our model. We will use derm graft, the superficial fat, washed and processed with our patent Italian system. We will inject it in order to elongate the chin and made to him a triangular shape. Despite of that, we will enlarge the middle part of the face by filling the malar area with the same fat. Filling of the cheekbone make our face more feminine, and looking at that profile, we will look on the nose. The nose, in particular the angle between the tip of the nose and the lip, look like the profile which was masculine of our Apollon. And so we have to move up the tip of the nose in order to make a more feminine nose. Why? Because males has smaller nasolabial angle compared with women. And despite of that, of course, we will correct the bumpiness of the nose that our patient doesn't like. Let's see the final result. I think that she had a very, very good amelioration. Sometimes we think that the big trauma are linked to big accident, traffic accident, flight accident. Today we will see a quite bad scar which was created by a totally stupid accident. A man who was looking for a bus, he was running in order to take it, it was in delay, he looked behind. After that, he turned too much at the last second to see these kind of things. So he crashed with the frontal area just in front of this. And today we have to solve his problem. So let's go to the clinic to do it. The clinic is a very nice clinic, but the building is quite old, so I have to keep attention in order not to make a trauma on myself. Let's go. Hi Giovanna, how are you?
Fine, thank you.
Great, our patient is waiting for us.
Come with me.
Let's fill this defect. You can see this line, the line of a trauma. We have to fill it. And we have to make even a little bit less dark because we have pigmentation and loss of volume. We did X-ray before in order to check that everything is okay. The treatment of our patient is quite easy. He had a trauma. The trauma creates a deficit of volume, a hole finally, and we have to fill this deficit of volume with the best filler that we can inject, which is the fat. Why is the best filler the fat, or better the derm graft? Because it's very rich of stem cells, so for regeneration of the scar, give us the best opportunity, plus is natural, of course, and plus is stable. So what we are doing, we are injecting at the level of the hole our filler, and we are correcting, and we will see immediately the result, the deficit of volume. Giovanna, you did a really great job. We have perfect correction of our scar and we'll have even improvement after with stem cells. Are you happy?
Yes.
Super, great.
Maria, how are you? Oh, fine.
So Maria, you are here not for you. I've seen in the agenda of SIM, I was quite surprised. You are not here for you, but for your husband, right?
Yes.
And what does your husband wants to do?
Oh,
There. Okay, so because it looks too much serious, too much a strong man, right? Because he's a biker.
Biker.
Yes, Harley Davidson and so on, so he's a super strong man. Okay, we will work on it in a natural way. You know that I love classic art. You can see my clinic is like a museum. Look, that is my grandparent. And you know, he's a very serious man. He doesn't have strong wrinkles, but he's super serious, super elegant. It has that kind of dress. It's not a tuxedo, because this painting was made in 1872, I think, and this man was the publisher of that newspaper. And you know, he's a super classical, serious man. I don't think that Salvo is dressed like this. No. Never did it in his life. But okay, we try to respect the gender, because now there is this trend in aesthetic medicine, in plastic surgery, to make these faces, which yes are beautiful. But we work, some of my colleagues, because I don't like it so much, some of my colleagues work in the malar area, in the central part of the face, on the lips, enlarging this part. And the result is this genderless aesthetic, which is that we make males a little bit feminine, like that painting. Do you like that painting? It's the subject is a child, is a teenager, is a really young man, and so that's why it's a little bit feminine, so blonde with curly hair, but even on the face, because it's before puberty, so it looks not so much masculine, but we don't want that Salvo become like this, right? Salvo will kill us if we do to him big cheekbone and so on. Okay, that's right. On Salvo we will work only on this part, we will work only on the muscles, and we will have super natural result. Okay, but did you convince him? Did you speak with him? You did?
Yes.
He's convinced? He's convinced, okay. So you can call him, and we will work on him in a super natural and masculine way. Call him.
Okay.
Oh, here the husband, finally! How are you, Salvo?
Okay.
Ready for the treatment. So you don't like this one? Yeah?
Yeah.
Okay, so it's a problem of expression, and is linked to some very small muscle, are our muscles of expression, and they are very useful for the relationship between us, between people, because by this muscle we can express with this one any kind of expression, negative, aggressive. Are you aggressive one, right? A little bit. You look like. Looking at your tattoo, they look very, very, very aggressive. What is this? Devil? Hell?
Yeah.
Is you?
My bike.
Ah, your bike, you, a devil, okay, hell, okay, it's written, hell, a lot of terrible images. Do you like this tattoo? Yes, it's approved by. And where is you? Did you represent your wife in this tattoo? No.
No.
Here there is a woman, but she doesn't look like her.
Santa Muerte.
Ah, muerte.
Santa Muerte.
Ah, okay. And here you have. Oh, but these are good. Integrity, respect, family.
Family.
So these ones are not negative. Okay, good. So you are not so bad. So we can work with Botox on you. That's great. That's great. So with botulinum we will do really small injection as salvo. So don't worry. Don't think that you worry for needle if you have so big tattoo, but don't worry. We will use a very small needle,
Okay.
and we will inject our botulinum toxin in 5 different points. All these points are linked to these specific muscles. That is, the muscle is called procerus and corrugator, 2 different muscles, and they are linked to the expression, negative expression, sadness, and so on. So, by reduction of this expression, we will have an improvement of your husband, so it will look less aggressive. Okay, so let's do it. Our toxin is ready. We have to mix the toxin with some saline, some water, because it's a super powerful drug. You know that only 1 gram of this drug can kill, will not kill you, don't worry, but can kill thousands of people, because it's one of the strongest drugs that we have in the market, and is a natural drug because it's produced by a specific bacteria. So we have to dilute and to dilute and to dilute and to dilute and to dilute. Finally, we will have our very safe treatment. Okay, let's do our treatment. We will inject in 5 different points. 1, 2, 3, 4, because we did 2 points at the center. That's super. It was painful, Salvo?
Okay.
It's okay? Good. So some recommendation and follow them,
Okay.
because they're very important to avoid sauna, Turkish bath, these kind of things, and big heating, because in that case will not have effect on botulinum toxin, because botulinum toxin is usually in the fridge and is a drug which is very sensitive to heating. But that's not the most important recommendation. The most important recommendation is to avoid to do physical exercise or movement by which you put your head down. Why? Because we inject in very specific point our botulinum toxin. And these points are not so far away from another small muscle, which is called levator palpebral superioris. It's the muscle which open the eye. So if for a strange reason or for strange movement the botulinum toxin goes to this muscle, arrive at these muscles, paralyze these muscles, the poor Salvo will not be able to open the eye, so we have the eyelids down, which is really terrible effect. Perhaps you will look more scaring, but it's not a good idea to have this kind of terrible effect with functional limitation. So please follow the rules. We will give to you a paper. You can read all the indication, because this product is super effective but like all the super effective product needs to follow the specific rules. Okay. Ready? Thank you, Salvo.
Thank you.
Thank you, Mario.
Thank you, Maria.
Thank you, Mario.
See you soon.
Bye.
Bye. Hi Ashik, how are you?
Fine, you?
Fine. Sima say me that you have this car, right?
Yes.
It's an old one. What's happened?
Before 10 years ago, so there was I was playing in one ground, no?
Okay.
So the ball entered in the hole.
Oh.
So I just put my hand to pick up the ball.
Huh?
And
Oof,
that's
what's
what happened.
happened? It was glass or something like
it
this?
It was a metal, like some
metal, cutting
yes.
metal.
Yes.
Yeah, it's a quite evident scar. This part is better. Did you do any kind of treatment?
Yes, I have done a treatment in Bangladesh,
Okay.
in my country. This part. Now I'm just waiting to do something for this part.
Yes, we can complete the treatment here, and we will do two kinds of treatment. If you have time, you can come immediately in my clinic. We'll do two kinds of treatment. Some injection of these steroids.
Okay.
Corticosteroids are basic drug, but if it's injected inside the skin, it can reduce the thickness of the scar, because this part has a very, very big thickness. And despite of that, we have a special machine, which is a shock wave machine. It's very, very effective for scar treatment, because it works very, very well in regeneration of the part. So we can combine these two treatments.
Yeah, okay, we can do it.
Super! Come with me.
Okay.
Let's do directly.
Fine.
Welcome.
Hi again. So, ready?
Yeah.
That is the machine that I say to you.
Okay.
It's a very high technology machine. It's made in Switzerland, in the German part of Switzerland, and it's super effective for scar and for even other indication like cellulite, regeneration, and so on. But it works very, very well. It's super serious machine. Come.
Okay.
It's not painful, the treatment, so don't worry about it. We will apply a small quantity of gel, because shock waves are similar, are not the same, but are similar to ultrasound. So to transmit the energy, we need to have this kind of gel, and we will apply this energy. Pain? No. Done. So we apply our energy.
Okay.
It's very, very effective. And now, after this treatment, let's do the injection of our super drugs, I will use a super small needle.
Okay.
And we inject, in particular in this part of the scar, very superficially, in order to correct the problem. Here we are. Even some injection here, even if this scar is not so bad, but it's a good idea to correct a little bit.
Okay.
Mario, this patient of Kiev.
Yes, these are the two soldiers from Ukraine. They send me these images. I've seen this one did a big reconstruction.
Exactly.
And yeah, he did a skin graft and a bone graft, so a transplantation of bone to reconstruct the feet, and we have this problem, this fistula, this communication, so we have to close it with our stem cells. And that's the
Another
other
patient.
one. Yeah, with a terrible scar here on the abdomen, and he has some problem even of facial palsy. So absolutely, I have to start my long journey because it's not so easy to arrive to Ukraine now.
It's not dangerous.
It's a little bit dangerous. That's why we have these terrible wounds. But I hope it will be safe. There are shelter, there are everything. So I will pay a lot of attention in order to come back.
Yes, of course, I hope.
Okay, let's go.
Let's go.
We are very excited to start our charity program. We are here at Orio Serio Airport at Bergamo Airport, flying to Moldova, and then from Moldova we will arrive by train to Kiev, Ukraine. We just arrived from the airport at the train station, which is behind me. We have so much time, more than 6 hours, so let's go to see how is the capital of Moldova. The first monument that we see is this one, is the monument at the victim of the communism. So it's not easy for sure, even the relationship between Moldova and Russia. It's full of this building of the Soviet Union period, where were probably not so beautiful at the beginning, but now, after so many years, they looks like really very hopeful. After 18 hours of travel, we are close to our destination. Finally, it was not a so easy travel. We can really understand how difficult it is for the Ukrainians to come back home in these old trains with old bathroom, the classical of old train that after so many hours they do not smell so good, of course. But finally, after so much time at the border, I think they checked my passport 100 times. Finally, we are close to Kiev. Arrive in Kiev, ready for our meeting. What is terrible, and an example about how terrible it is this place, Maidan place, an iconic place, a place of the revolution of Ukraine, and all of these flags. On every flag there is a name of the poor soldier, Ukrainian, and not all Ukrainian who died in this terrible war till now. And today we will do a charity program for the victim of war, and we will do the most advanced treatment
on the victim of war. So let's come with us and let's see how can be incredible, terrible, the conflict between nations. Here we are in our wonderful 5-star hotel with a beautiful view of the Dnieper River. Here we have air alarm, and so by our stairs we arrive at our shelters. So here we are. I was sleeping in a wonderful apartment at the 10th floor, but this night we will sleep in the garage of the hotel. Okay, I hear hand of a bellezza, so I can come back to my room, luckily. Very efficient in terms of improve healing of the tissue, improve the quality of the tissue.
Ну і так потім
This hotel is really beautiful. The hotel of the conference, full of marble, full of gold, painting, but there is something strange. Today, when I did the check-in, they give to me a paper to sign, a disclosure. Mario will explain to you where is the shelter, what to do in case of bombing, and even an information. If I will have any kind of damages, the hotel is not responsible about these damages, but the Russians are. So, in case of damages, please Mario, ask to put in.
Hello,
Hi Sergio.
Nice to meet you. How are you?
Fine, it's great to meet here, under the war, in Kiev. And so today we are here in this wonderful hotel to do our conference. So I thank you for your support and for the support of your association. What is your association?
My association was born in 2007. The purpose of the association is to help children of orphan trophies of Ukraine.
So it was born before the war. That's great. So thank you for your support. Today it will be very useful, your support, in order to do this conference about treatment of scar. My colleagues are very good. Ukrainian doctors, Ukrainian surgeons are very good, but it will be very useful for them, for all of us, to discuss about innovation, about stem cells treatment in order to improve this real emergency now are full of poor soldiers, but even civilian with these terrible damages. So our support, our Italian support, it will be very useful for them. So thank you again. You like to come with me at the conference?
Let's go together.
Are you sure? It's a little bit impressive. Okay, let's go. Okay, so I signed my book for you and for your friend, of course.
Thank you.
So Lada, it will be a great day today for this kind of incredible program that you started, Zagrava.
Yes.
What is a program for?
That's a program which exists for 1 year for charity, and we give treatment to patients, to military and to civilians who was traumatized during the war. So
And you give for free.
yes, it's a charity, of course. So that's we do that, of course, for free. And now it's more than 100 patients who already has that treatment. So we are very happy as the doctors to help.
So it's really a big program. When you start to talk with me about it, I was really impressed about it, and so I'm sure that we can involve a lot of people in all of Europe in order to support this program in any way. The most important thing is to restore the scar, because the scar are memory of this tragic period.
And
so
our logo of our Zagrava, this is the erasing of traces of war. So yes, that's it.
Let's go.
No.
Hi Daniel. So, what's happened to you?
7-11 числа, находясь на Бахмуте, мы прикрывали эвакуацию.
So you was in war, in full war, you are in troops, and you had this big accident because of this tank cruise, right? It was disrupted by this rocket against tank. So we have this damage on the face. Please close your eye. So you cannot close your eye, smile. And you cannot smile because this is the facial nerve, and you did a surgical intervention, so this scar is because of it. And I'm sure that you will come back normal there, but you still have scar here, and even I've seen here on the legs, and even here. So we will work on all of this area today with regenerative medicine. Ready?
Yes.
Let's go. We are ready to do the treatment on our soldier. We will inject our enriched nanograft on the scar of the abdomen. This patient had really a terrible surgery, a so big cutting, a so big surgery. He had a really high risk to die. And we inject the same product even on the face. Why on the face? Because the facial nerve was damaged. The facial nerve is a very important nerve because it's the nerve to move the face. And all we know how is horrible, how is a big problem to not move the face. So the patient had previous surgery, but now by using our stem cells, we can improve the healing, and we can speed up the healing, which is usually very slow, of this important nerve. Perfect. So you have all of your medicine, all of your cream for the scar, very important, and thank you to be with us, and thank you for your sacrifice, really. I hope that all will be okay. See you soon. Bye.
I have a little present for you.
Oh,
It's Chevron National Guardian of Ukraine.
oh, thank you very much.
Our flag.
Thank you, because I have two sons, so one for one and one for the other one. Thank you very much.
Thank you.
So Valentina, you bring me your husband, and we have luckily with this terrible problem on the leg. What's happened?
Так, да, в момент звільнення, під час звільнення Харківської області.
So 7 months ago, in war, with this terrible war with drones, the drones look at you, and so they send rockets which make this terrible damage, and now you did a lot of surgical intervention in order to repair it, and so we are here in order to improve your condition with stem cells and with fat, in order to have as much as we can the best result. So sorry about your problem, but we are here to help you. Okay, let's go. And that's your military platelet, right? With name. And what is this symbol? This one.
Велес. Слов'янський Бог.
Ah,
The Slavic God.
Slavic god.
Yes. Just right after the military hospital, everything was in inflammation, was red, and here was the size of leg was 3 times bigger. So we prescribe anti-inflammatory, venotonic, diuretics, and also we inject plasma therapy and polynucleotides like from combustiology.
We will do like this. We will take some fat from.
Do you have fat?
Yes, yes. Even because he cannot move a lot, so he has fat for sure. And he has a very nice wife, so I'm sure he make for him borщ and some other things.
У вас дуже гарна і хороша дружина, вона вам варить борщі, все, так що жир у вас.
Okay. And so yes, we'll take fat from here. We'll take stem cell. It's not painful. No больно.
Не больно.
Не больно. Okay. Let's do the treatment of our soldier. The treatment is focused on the leg. The leg who had a lot of surgery before. This patient has a risk of amputation. At the beginning they wanted to cut his leg, but luckily, finally, by the transfer of many tissue of skin, of bone from other part of the body to the leg, we have this kind of situation, which is not perfect. In particular, we have a problem with this fistula, this communication between the graft of the bone and the external part of the feet. We have to close it, and to do it, we will use our patent system of concentration of fat stem cells. It's an Italian technology, and that's why I'm here to instruct the doctor in order that are able to do this kind of treatment by themselves. And so we are injecting our stromal and vascular fraction, so the high concentrated area, in the area around the wound. The idea is to improve and to speed up the closure of this wound. We are injecting under local anesthesia this enriched nanograft, this emulsion very rich of stem cells for the regeneration of the legs on our patient.
Thank you very much.
See you next time. See you next time, and good healing. Today we are in a wonderful place. You can see behind me these wonderful colored cabins, and behind the cabins the ocean and one of the most famous beach for surfing. So a lot of super sporty and young people here to play sport. And after this beach we will go to a beautiful clinic just behind here. The owner has my same car, a Maserati, so we will go with his Maserati, and we will do a very specific treatment, a very masculine treatment. We will work on the penis, we will inject stem cells in the penis of our patients in order to improve the quality of intercourse, so a very specific treatment, and we will use the fat harvest from the penis for the patient itself to inject the penis to increase the volume of the penis. So let's see how will be our treatment. Let's come with me in the clinic. So, we are ready to do our penis augmentation. This is a centimeter, sterile of course. Here we are, let's start our procedures. It's a procedures of enlargement of the penis. It's really strange to think that this procedure is very common in Africa. This clinic is based mainly on this kind of treatment. It's strange because there are many scientific articles who do the measurement of the length of the penis, and in Africa there is the maximum average of the dimension of the penis is bigger compared with Europe and compared with Asia. Despite of that, there is a big request, mainly is a psychological problem like the locker room syndrome, shower syndrome, and so on. It should be like this, but despite of that, the request of the patients are height demanding. And what is the best product that we can use is the derm graft, the superficial fat that can be injected under local anesthesia, and by this way we can have an immediate result in terms mainly of the enlargement of the penis. The procedure is done. We have used our derm graft in order to fill the penis to enlarge and even to do elongation of the penis. Now the penis is bigger, and plus we use stromal and vascular fraction in order to improve the quality of intercourse. So I was terrible.
It's okay.
It was like this, no pain but not so comfortable, but it was fast, 25 minutes, and we complete all the procedures. We did it under local anesthesia without any kind of sedation, so our patient was very, very good. But the motivation is good, right?
Yeah.
Girls, you are right? Okay, good. We are at the end of our episode. I don't know what Constantine should think about these men who do a lot of aesthetic treatment, Botox. For sure, you should think that these men are crazy. But for sure, it should be very interested about the advanced treatment of the victim of war. At this time, there were so many victims of war with terrible wounds, and it wasn't for sure not so easy to have good healing or to survive after the Milvio battle or this kind of famous battle of this time. But I hope at the meantime that for you this episode was interesting, and I invite you at the next episode.